Today we're going to learn about a therapy called the magic sock therapy. This is the kind of therapy we do when people are sick and they have a cough or they're feeling congested in their sinuses and they hurt and they have an ear infection. And the purpose of the therapy is to drain the congestion from the sinuses and the ears down towards the feet. So even though this therapy sounds a little bit strange, you're going to find that this works very, very well. And this is Rebecca, who is pretending to be sick. And this is Anna, our therapist, who's going to help us do the wet socks. So first of all, you have the patient lie down and cover them up with a blanket, which we didn't bother doing. And you get a pair of her socks, and we're going to go wet them in the sink. Okay, so first run water until it's nice and hot, and you rinse the socks out in hot water and wring them out. Perfect. Wring them just enough so they're not dripping, but not so much that they're dry. Next, you put the warm, wet socks on her feet. This actually feels really good because they're nice and warm and they feel good. And you slide them over her feet. They should be wrung out enough so that they don't drip. And sometimes they're hard to get on because they're wet. Once you have the wet sock on, you take a wool sock that's larger than the wet sock, larger than the patient's foot, and you put it on over the wet sock to keep the wet sock warm and to keep the sock from getting water on the bed. Now, if you don't have wool socks, you can use very large cotton socks. That'll be fine. Now, what will happen in about 5 minutes or less, sometimes 2 minutes, you'll notice that the patient feels a lot better and their sinuses are clearer and they will breathe better and their ears will stop hurting. And you can leave those socks on for about 6 hours. So a lot of times patients will go to sleep. They'll fall asleep better because their head feels clear and they'll sleep through the night. Thank you guys for being a help, Rebecca, and thank you, Anna.